Since before our country was founded, Catholic institutions have been caring for the sick, educating our nation's children, and serving those most in need through their hospitals and healthcare ministries, schools, colleges, and universities, and through a large network of social service ministries all across our country. For Catholics, the practice of our faith has always required not just acts of worship, but also necessarily loving, charitable service to others, not just to Catholics, but to everyone. We believe that we are called to uphold the inherent dignity and worth of every human being. I'm Jane Belford. I serve as Chancellor of the Archdiocese of Washington and oversee our legal activities. The Archdiocese of Washington and several of its related ministries have joined other Catholic organizations across the country in a lawsuit challenging the Department of Health and Human Services' attempt to dramatically redefine what is and what is not a religious institution in the eyes of the law. This redefinition has serious, concrete consequences. The First Amendment protects religious organizations' right to act in accordance with their beliefs. But if the law says you aren't religious anymore, you lose that right. In this case, as part of the new healthcare legislation, HHS issued a mandate requiring all employers to pay for insurance coverage for abortion-inducing drugs, contraception, and sterilization, which our faith teaches are morally wrong. Ignoring broader religious exemptions from other federal laws, HHS crafted an exemption that uses a new definition of religious institution, a definition that is so narrow that only a house of worship itself qualifies. The government's redefinition of religion attacks religious freedom by defining it away. By extending religious freedom protection only to houses of worship, the federal government is reducing religious freedom to simply the freedom to worship. But our faith is more than what we do on Sunday mornings. We practice our faith when we put it into action. Our schools, our hospitals, our social service institutions, our charities, they are as indispensable to our faith as our parishes. They are religious organizations by any reasonable definition. The government has never before contested that organizations like Catholic University and Archbishop Carroll High School are religious institutions. Under the HHS mandate, though, even Jesus and his disciples would not have qualified as religious enough. This lawsuit isn't about contraception. With a prescription, birth control pills are readily available at major retailers for $9 a month and at no cost from various healthcare clinics. This lawsuit does not challenge women's established legal right to obtain and use contraception, nor does it challenge any employer's right to provide and pay for it. Instead, we are simply asking that the government continue to recognize the religious nature of our organizations and allow them to keep the rights that the First Amendment guarantees them. If the mandate stands as is, we have no real choices. We must either violate our religious beliefs, one way or another, or face crippling fines and penalties. The fine for an institution like the Archdiocese of Washington, which employs 2,100 people, would be at least $4.2 million a year, and possibly much more. There is a solution, and it's simple. The administration should admit that it isn't necessary to drastically change the way our laws have traditionally understood religious ministry. The administration should acknowledge that when Mother Teresa was working to ease misery and suffering, she was practicing her religion. In the coming days, as you read and hear more about all of this, please do two things for us. First, make sure those you encounter get the real facts. But more importantly, please pray for us and pray for the protection of religious liberty, our nation's first and most cherished freedom. Thank you for your time.